In this video, we will look at the different types of personal protective equipment, PPE, and respiratory protective equipment, RPE, you will need for working with non-licensed asbestos materials. We will discuss the use, maintenance, cleaning, and disposal of protective equipment such as coveralls, gloves, footwear, and RPE. We will look at different types of disposable and reusable RPE, and also consider the importance of face fit testing. Always check the work area before you begin, so you don't mistakenly disturb asbestos materials. Only start work if you are properly trained and have the right equipment. Coveralls are a one-piece protective garment worn to protect the upper and lower body from contamination. Only disposable coveralls can be worn when working with asbestos, and only type 5 or 6 are suitable. As disposable coveralls are prone to rip at the seams with movement, it is good practice to wear one size larger. To minimise the chance of letting dust in, you should seal loose cuffs with tape and always wear the coverall legs over footwear. Avoid wearing a long-sleeved shirt. These are difficult to cover properly, and wear the hood of your coveralls over the RPE straps to protect them from contamination. Always decontaminate and dispose of used coveralls as asbestos waste. Never take them home. If you wear protective gloves, make sure they are single-use disposable gloves. Latex gloves may be worn, but these can sometimes cause problems with the skin. Always dispose of your used gloves as asbestos waste. Boots are preferable to disposable overshoes, which can cause a slipping risk. Never use laced boots, as they are very difficult to clean properly. Your RPE plays a key role in protecting your health. It is essential that your RPE is the right standard and that it fits you properly. A dust mask, doubled up for more protection, will not provide the user with adequate protection. Suitable types of RPE for most short-duration, non-licensed work with asbestos are disposable respirators to FFP3 standard, half-mask respirators with P3 standard filters, or semi-disposable respirators with P3 standard filters. Always check your respirator has a UK assigned protection factor, APF, of 20 or more. You must be face fit tested to make sure that the RPE can be worn properly. If it doesn't make a tight seal, you won't be fully protected from asbestos fibres. You must be properly trained on the use and inspection of your RPE before the work starts. You need to know how to check your respirator is working, how to check that it fits, how to identify defects, and about the limitations of your RPE. You must know what to do in an emergency, such as failure or damage to your RPE, and you must be medically fit to wear RPE. Seek medical advice if you're not sure. Once you have finished working, take off your RPE last, and if it is disposable, put it in the asbestos waste. For non-disposable RPE, clean after use and store in a safe place away from contamination. It is important to keep your RPE clean and in good working order, always following the manufacturer's instructions. If you use a half-mask respirator, be sure to change the filters regularly and dispose of used filters as asbestos waste. You must inspect and check your RPE for damage every time you use it. For non-disposable RPE, carry out thorough checks monthly. Your RPE check should cover all parts, including the valves and seals. If you note any damage, replace the respirator as appropriate.